Good morning, good afternoon, good evening. It depends on when you're listening. We are the solution. Nothing changes if we change nothing. We're housed at Children's Aid and we are funded by OASIS, actually New York State OASIS, the Office of Addiction Services and Support. Hi, Chevar.
Good afternoon, Ronnie, and everyone listening and/or watching. Hey, I'm happy the sun is out. That's why I'm like so happy. Like I love the sun. If you guys have been listening, I'm a big sun person, so I'm happy. Uh,
Yeah, you could see. I mean, it's funny because the last podcast we did too, it was out, and you could see it because we're doing these podcasts from the comfort of home,
mm-hmm.
and what you hear and what you see is what's really happening. It what makes it real.
So where I live, for listeners, you guys know you will hear all types of sounds: trains, buses, ambulances, fire trucks, everything. Just because of where I live, like nothing crazy, nothing dangerous. Like there's a hospital right there.
And I turn around and look at my dog every now and then because she may be misbehaving, but otherwise, we'll be watching you.
hmm
Well,
But I'm excited. Our last podcast was with the pop members, and it was really cool. I'm excited about the future of pop and where they're going. We had a meeting today. Well, for those of you who be recently who's watching this, and we talked about changes in our great city, New York, because a lot of people in general people forget how large New York is and how dense, not even large, how dense New York is, in the diversity of culture and people, in size. And we talked about the policy of how do we create a policy around alcohol to go, because that's the thing that's coming up. We talked about it briefly. We talked about how at the beginning of the pandemic there was a different policy based on the not the state, but based on the providers, the delivery providers. I don't want to say any names, but based on the delivery providers. And and when the pandemic was still going, those delivery providers changed their policies that will more benefit them. And I'm referring to like alcohol to go, meaning that any age theoretically can order alcohol and there's no face attached.
exactly.
And, and before, I think at the beginning they were checking for ID, or making sure that the person was of age. But I mean, I don't know what the policy says now, but I know the policy did change to uh, we are responsible for, which is like,
Yeah, well, we definitely need to look at it closely because it was just brought back, and there's talk of making it permanent here in New York State. And sometimes when these things get passed, we don't look at the ramifications
right.
and how they affect youth and people, who might have an addiction to alcohol. I mean,
Yes,
yes, it's their choice, but I'm
yes.
really concerned about youth because we know that we have a drinking age of 21, and
hmm
I remember when this first came out too, we were looking at the way they advertised
hmm
and made it so appealing, especially
hmm
in certain neighborhoods,
hmm hmm
so that when young people would pass, they'd see this these giant pictures that look like Kool-Aid
Yes.
and make some, so talk about drinking the Kool-Aid. But so I'm so glad that we're looking at this, and even if there are rules and there are restrictions built in, we have to make sure they're enforced and that people know about
Absolutely.
them.
Absolutely. 1000%. We have to, whether it's having a local politician involved, or compliance checks by law enforcement, or, the use of uh, social media, or the community itself, like, making sure that when delivery comes, if an adult isn't there, they shouldn't be delivering alcohol. And these providers, these delivery providers, should be held accountable outside of your policy. Saying, again, I don't know what it says now, but with the last time I read it, they said that they can't take responsibility, which you can. Like you can't. You can. I'm gonna go for the whole other thing, but I'm excited about that. We also looked at one of our members sent us a document on the marijuana laws and how it's going to be handled. There's a lot of information in there that's confusing. That that, and I did mention something you always mention to us is this let's share the facts. Let's share the facts. You know, there are facts that are confusing about underage consumption or underage possession. Uh, and again, I don't want to share facts, share information that I don't fully understand yet. But there's a
I
lot of
understand.
information in there for. I do know if it did say if you sell or distribute to a minor under the age of 18, it's a felony.
Yeah, I really, I want to know more about this too, so we can, I mean, the whole thing is, we're not here to tell people how to think.
No,
We're
no,
not
not at
here,
all.
but we're here to provide you with as much factual information as
Hmm.
possible to make a decision that works for you in your life. And, with young people, we want to see them make a healthier choice so that they
Hmm.
can go on a path that's a more positive path in their life. So we
Hmm.
want to arm people with information. It's all about really knowing and understanding, and so often that's not provided. So I really can appreciate what you're saying about really getting to know it. But yeah, now I want to know more about that.
No, it was a great conversation. It was like, oh wow, why is this meeting over? Well, hey, there it goes. You get interrupted every time. And why is this meeting so short? That's how people felt. Like, why are we not continuing this conversation? And I think the positive, that Milo shared is that we're going to meet more frequently, opposed to once a month.
Oh, that's great.
So like, and the members they're excited about it. It's information there that's very helpful, and we're gonna learn a lot. We're gonna learn about different these looks like license plates numbers, like 3 letters and then 4 numbers. So
Really. I'm so sorry I had to miss that today, but
it's
what
like
a great meeting. And you said like 15 people showed, so that excites me because it's not just, us, it's our
right.
providers and the people that we're working with who are taking a lot of interest, including our coalitions. Well, speaking of prevention and that work and coordination of providers, in not just prevention, but in treatment and recovery, we've been very fortunate and blessed to be part of something called the CASN, and I'm going to let them tell you what it is, but we've got a couple of people here, so why don't I let them in and let them start talking about it?
Go
Does that work?
for it. Go for it.
Okay. We're going to admit them all. So we're about to admit a couple of people, and of course, Shapar, you were talking.
Yeah, that's just the thing that happens.
Okay, I see our guests are arriving, and very happy to see them here today. I was going to say good morning, but it's been that kind of day. Good afternoon, and
Hi,
welcome
how are
to.
you?
Good. How you doing? We'll let Troy's internet connect, and then we'll get you to introduce yourselves. Okay. Well, welcome.
Do you want me to put my name, a different name, or the agency, or how would you like it to show on the video? I didn't know if you had a specific preference.
Just share your name with us. That the name was
Yeah.
good enough. Thank you.
Okay.
Okay. So we're recording now. So please join us, and why don't you introduce yourself, and we'll have each of you introduce yourself. Plus, we have a third guest coming soon.
Okay, I can go first. I'm Dr. Carolann Slattery. I'm the Vice President of Outpatient Services for Samaritan Daytop Village.
We're so happy to have you here. Thank you.
Yes, I'm very excited.
And Troy, why don't you introduce
Good
yourself?
afternoon. My name is Troy Boze, and I'm Recovery Services Coordinator for Offsite Partnerships for the Education Alliance Center for Recovery and Wellness here in Manhattan.
Well, we are so delighted to have both of you here. We represent the New York City Prevention Resource Center, and a lot of our work is in prevention, but we love the idea of all three tiers combining because so much of it, I'm from the mindset of the whole recovery-oriented system of care, the ROSC. I'm a person in long-term recovery, so I see recovery on every level of this tier. And we're going to look at how across the city we're working together to make that happen. So we've got Jessica who just joined us. So Jessica, please, would you introduce yourself and tell us what you do?
Yes, absolutely. Hi, everyone. My name is Jessica Boylan. I'm the project director from Coordinated Behavioral Care, specifically for this grant, Citywide Addiction Support Network. I am managing and overseeing the grant and the rollout.
Now, could you tell our viewers and our listeners, what it is? What is CASN? I mean, it's a cool, set of letters, and I know now we even have tablecloths, but what is it?
Absolutely. So, as we all know, the city is facing an ongoing epidemic with opioid crisis. And so with our partners at Oasis, we have been awarded a state opioid response grant for 3 of the 5 boroughs for the Bronx, Manhattan, and Queens. So what we did is we formed this new network. So we have 21 community agencies joined with New York City Health and Hospitals. And really we're working together to build referrals and collaborate together to enhance the services for our, the clients living in the city struggling with opioid and stimulant use.
Well, thank you for sharing about that. And there's such great work being done. And as I mentioned earlier, we have someone here from the recovery field, someone from the treatment field, and we're here from the prevention field. So it's nice to bring this. I used to say when I worked in Maine, I was in overdose prevention, and I coordinated all of the recovery services, recovery and prevention services for the City of Portland Public Health Division. And we used to talk about bringing everybody under the tent together. And I feel that's what we're doing here. We're under the tent, we're working together. And by the way, Troy, I love that background. That looks like, I'm trying to see the guitar. It looks kind of like my SG, but not quite. But I'm a musician, and it's nice to see that. But could each of you talk a little bit about the work you're doing? And then we'll, if we have questions for each other, please feel free to jump in and ask.
I mean, I could go first, Jessica, if you want, as the lead agency. So Samaritan Daytop Village obviously is been presented as the lead agency for this grant, which has been very exciting for us. We are representing the not prevention, but treatment and recovery side of the grant. And what that afforded us was we as treatment and recovery were able to look at those 3 areas, and the depth and breadth of the vision of the grant was to have no wrong door for a client, but no wrong door with access, meaning where you have clients that are within the community or soon to be clients, if you can, and they might need residential, they might need detox, they might need outpatient, they might need recovery. And if that needs to be happen, how do we get that to them? So we can't make the clients come to us, right? We wanted to be able to engage and motivate them out in the community. And our goal was when the overdose rate and the suicide rate was being spoken about was rising at a level of proportion to where we were not able to see what can we do to help all of these individuals to gain access into medication-assisted treatment. So it's under the SOARS grant, and the SOARS grant with SAMHSA and the state was looking at individuals with opioid use disorder and stimulant use disorder, and how can we help them, motivate them, or gain insight into soon-to-be recovery. So the city looked at those areas where if it's in the middle of the night or if it's in the daytime, 24/7 open access. And that is where the agencies got together, and Samaritan and also Health and Hospital was awarded the funding to be able to implement staffing, because a lot of times the providers that we have right now don't have the staffing. And then we saw that networking needed to happen also. So we could have a big pile of money, but if we're not all working together and talking together and helping each other, that's a barrier. So what Oasis said was, what are the barriers that we need to break down? Transportation, medication, open access 24/7, motivation in inciting the clients, and be able to have warm handoffs from hospitals, from criminal justice with reentry, and then also with treatment and detox. So this grant is allowing all of that to come together. And the vision and the depth and breadth of the grant was, how do we, if we give them all of these tools, how do we help them to sustain? So how are we going to help the person understand we're here to help, and we're here to help for the long haul, not just, go to the ER, get a medication, and then where are you left with? So once they get that medication, and once we are able with peers and with with social workers and with docs and nurses all working with that client, kind of like wraparound services, true wraparound. And giving them guidance to say, this works. Do you feel better? And in some time, when they have a little bit of more clarity, then get them to start treatment. And then after treatment, recovery, and the recovery coaches and the recovery centers are there during treatment, before, after, and during. So that's, I guess, the Reader's Digest version of how wonderful the grant is. What's amazing about the network, as you said, Citywide Addiction Support Network, is these 21 providers. We all know of each other, but do we all actually work with each other? And that is where it has been absolutely amazing to see, when you get a bunch of community providers, and that's like the big word, the community, because it's all within the community, and prevention being huge about that. And obviously you'll talk about that. How do we work together to understand? And that's where CBC, with the Citywide Addiction Support Network, was able to come up with a geomap, was able to come up with instant communication, because you don't want to call a dead cell or a dead phone or voicemail, because when the client is in need, you have to capture the client where they're at that moment. There is no wait. There is no, let's talk tomorrow. So we needed all the network providers to understand the immediate concern and the need for urgency. And this grant allowed that sense of urgency to roll out. And it's been amazing to play out, and it's been amazing to see how we're all able to try to come together and work together on it.
Yeah, I hear you describe it, and it makes me teary-eyed. I mean, I've been in this field a long time, and this was our dream back in 2003 when I formed one of the first overdose prevention projects in the country. And, we talked about this stuff, and seeing it come to fruition is just incredible. So I know that this grant is for 3 boroughs, but can anybody from across the city call or get in touch with you, say they're in Staten Island or they're in Brooklyn, where the grant is not? Can they still utilize these services?
So the grant actually is in other boroughs and stuff like that, but CASN, Citywide Addiction Support Network, was not, awarded, those boroughs. However, yes, if someone is sitting in Staten Island, our agency even has a program in Staten Island. If someone's in Staten Island and needs help, the providers are here to help. So there's no door that's being closed on anyone. It's our goal to help. We have looked at, in the areas of Manhattan and the Bronx and Queens, what does the community need in regards to being in the parks or being out where, criminal justice, the reentry, and with COVID and with courts closing and reopening and closing, we're trying to accommodate all parts of the network. But I will tell you that because you have this grant and because we have the staffing that we've been able to get, you could be anywhere and get assistance. And what's amazing is you don't have to walk into 4 walls. You can just pick up the phone, make a telephone call and say, I need help. And what help do you need? And, if you need medication because of the way the telehealth marketing is working right now and the waivers that were put in, you're able to get immediate medication within a couple of hours or within 30 minutes, depending on the time. They can get the medication that's needed, or you can get a referral and a peer or someone to help get you into a detox or to a residential or to the hospital if there's a medical situation happening. So you could be anywhere. The telephone is your friend. You don't need the war. It's outside the 4 walls.
This is incredible. It's so cutting edge when you think about it. Really, everything New York's been doing lately is so impressive. So let's say somebody wants to get in touch with you and access those services. How do they do it? Like, their telephone number they can call? So if somebody listening to this is motivated and they hear the number, you may be getting some calls.
Yep. So there's a phone number that we've advertised, and we can, give you that number. There's also a referral link. So on a website, you can go onto our website and be able to put a referral in for 24/7. It could be at 2:00 in the morning. And we have a turnaround of someone being able to access that website. And there's also 24-hour calling service. So it's a 24-hour crisis line and helpline. So even though the program is closed, that phone line is 24/7. And so if you call, and we have had calls at 2:00, 3:00, 4:00 in the morning, I need help. Sometimes I don't know I need what I need someone to tell me, or I need help, or I just want to talk. And so what's great is the staffing pattern is you have your peers and you have the recovery coaches, you have your social workers, you have your medical staff, and they're all on call to assist and ask the questions, answer the questions, how can we help? How can we be there for you? And if medication is needed, we have a linkage with a pharmacy that 24/7 will deliver the medication to any address. So they just can't deliver to a street, but they will deliver to any address, even a shelter. So we are here to help all types of population.
Okay, well, we'll definitely want to get that information from you, and anything you could share verbally, and we'll also make sure to put it in the comments,
Sure.
of the video. Okay, well, thank you so much for sharing that. I'm sure we'll have more questions, but I want to give Troy a chance. Tell us how you fit into all of this.
Well, thank you once again for inviting me to this podcast. And Dr. Slattery, I'm glad that you were able to explain that what you did, because that is not my lane. I am a certified recovery peer advocate. What that simply means is that whatever the things that Dr. Slattery mentioned, I'm that connector. I'm that person with the lived experience. For example, my team does outreach in Washington Square Park. 30 years ago, I slept in that park. I provided musical performances in that park to eat on a daily basis. Hence, what you see in the background there is a program that I created called the Musical Pathway to Wellness program, because peers are non-clinical. We come from a non-clinical, holistic, instrumental, supportive, emotional support, lived experience venue. In other words, I've been there, dude. I walked that walk. I've done some of the same things you did. I identified. So my support comes from sheer identification, emotionally, spiritually, mentally, about what you're going through. Now, guess what? How did I get out? I got out by just what Dr. Slattery was talking about. I went to organizations. I reached out. I used the phone. I've been in 155 detoxes, 65 rehabs, 5 long-term facilities, 7 years of prison. I've been through it in and out. So listen, dude, this is how I got out. And guess what? Now that I'm out, doesn't mean I've arrived. I'm still on my recovery process, and I still carry those organizations and those connections with me. Would you like me to share them with you? And that's what the peer does. He says, man, listen, I identify exactly where you're coming from. I don't want to rehash the past, nor do I want to live there. I want to move you forward, because that's what peers do. We move forward, because in the past is resentments. In the future causes anxiety. So we try to stay in the present. What do you need now, and how can I support you right now? The state has credentialed me to provide you a doorway in, where otherwise you may have not been able to get in, because you may have needed a person with a credential to walk you through the door. Well, guess what? I speak your language. I'm non-clinical. I'm not going to assess and diagnose you. I don't need to do that. I know you're messed up, because I'm still messed up. I want to know, how can you and I get unmessed up? So guess what? This is what I do. I go to Samaritan Village. I go to Education Alliance. I go to Fortune in Society. I go down to the food pantry every now and then. I know some places where I can get a free haircut, a meal, and wash my clothes. How about that one? How about this? You don't even have to sleep in the park tonight. There's a shelter right up the street. If you want me to walk you there, I'll do that. That's that affiliative support. Guess what? I'm not scared to go in the shelter. Are you afraid to go in the shelter? I'll tell you what, I'll go with you. That's that advocacy. That's the part that the peer role plays in. He says, listen, man, I'll walk through with your recovery process as long as you want me to. And if you feel like you don't want me to walk with you, then I'll take a walk. But guess what? I'll still be here in case you need me. You understand what I'm saying? Because the peer role is volunteer. You're not mandated to work with me. But I'm going to say this to you. I'm a multidimensional peer. I have 5 offices. I run MSBI, detox and rehab, the MAP program in Brooklyn, the emergency room in Queens. I have an office in the Manhattan Treatment Court because I'm a justice peer. Where else? RWA, the men's shelter, the working shelter, ready, willing, and able. I am the advocate peer there. So when people come to me and they say, listen, man, you know, I just finished my rehab. I want a job. I need a paycheck, boom. And plus I need somewhere to live. Listen, I got a program that will give you all three of that in one shot. The RWA program. It's a shelter. You get plenty of food and you get a paycheck at the end of the week. How about that one? How about this? Oh, you're homeless? Oh, maybe I can help you out with the ACE program, which will also train you, pay you to go there and get your certification where you can get a job at the Empire State Building as a janitor. What about that one? Hey, how about this? Oh, Social Security? Oh, no problem. I was on Social Security for 10 years. Guess what? You don't have to go in and do the kiosk. I will make you an appointment because I can call Miss Bell there, the case manager, and walk you in there. How about that? Oh, you got to research for HRA? Oh, well, guess what? Mr. Clark used to be my case manager. You don't have to go and get a number. I'll call and make you an appointment and let them know I am your navigator, and I'll walk you to your appointment. How about that? That's called community navigation. And this is the kind of things that peers do. We're down on the ground. I don't care. Listen, I made video of cats that count. I was with a dude in Washington Square Park who came from Boston with no shirt, no shoes on. He was so adamant about getting into some recovery that because of a friend of his said he came to New York and he got an apartment and he got into recovery. And I said, dude, you came all the way out here with just that? He said, yeah. So guess what? I affiliated him with the Bellevue Men's Shelter. I even gave him a sandwich and some water. 3 weeks later, I went out to the park. This guy came up to me. He said, oh, I remember you, Troy. He had a haircut. He had some clothes on. He said, I'm at the Bellevue Men's Shelter, man, and I'm getting ready. They're going to hook me up with some house people. And that's the highlight of what I do as a peer. You know, what it does for me spiritually in my own personal recovery walk is priceless because it's a reciprocal relationship that we have with the recoveries we work with. Now, the clinicians call them clients. They're not my clients. They're recoveries to me. After all, I'm in recovery, you're in recovery, you're in recovery. Hey, what's up, brother? Hi, how you doing, sister? Oh, guess what? I also have an office at ACS. Forgot to talk about that. I also work with females who need to get their children back because their children were taken away from them because they were doing substances. Well, guess what, sister? The world is not the end of the world. Why don't we first get you some visitations, right, so you can make that connection with your child again? But first of all, let's get off the substances. Where do you need to go? You need to go. You need to get affiliated with Samaritan. You need to get affiliated with Education Alliance, Realization Center. Which one you want to go to? Because guess what? I don't tell you what to do. I don't tell you where to go. I just paint a picture and I give you options because people, there's nothing wrong with people. They don't do things wrong. They make bad decisions. So as a peer, I try to open up options because that's what somebody did for me. And all I do is give it back, you know? And so in my walk doing with the CASN grant, when that came along, that was like just a pillar of the pinnacle of my professional development. Because I said, gee, Washington Square Park, oh my God, I used to sleep there. So how am I going to do this? Well, used to play music there too. So guess what? I took my bass guitar out to Washington Square Park. I started jamming out. Of course, that's going to cause a crowd. Somebody wanted to come and give me a tip. I said, no, I'm not here for tips, but let me give you a tip. You see those people laying around out there? One of them could be in some distress. This is a Narcan kit. Let me do a Narcan training with you, man. Next thing you know, it was like a snowball effect. Every Saturday we're out there, 30, 40 people doing Narcan. I'm doing Narcan, my team now, because I have a team now, doing Narcan trainings, doing video. Of course, we get consent from the people. We're right across the street from NYU, and guess what happened? The students there that are doing the addiction program came over to see what we're doing. And they're like going, oh my God, this is my thesis right here, you know, like in live version, right? And I'm giving it to them in the order, in straightforward, boom, this is what we do. And we got a connection with the NYU student team over there. Then guess what happened? The sergeant for the Park Police Department thought I was selling Narcan kits. So, so she comes over to me and she says, first of all, you can't play your guitar around here because no amps are allowed. After I converted her, like I'm just doing you guys right now, because once you're a pickle, you can't go back to being a cucumber. She said, oh my God, that's awesome, Holly Park. So he said, oh, boom, maybe we can set you guys up in Holly Park, because that's a main area there where they're using and blah, blah, blah. And then we just let her know about the one-stop shop that we observe, because as peers with lived experience, listen, you could go there, buy your marijuana, go outside, get your beer, and then you come back to the park and party. and I let her know that's what's going on. And thanks to Jessica Boylan there and Christopher from the CASN grant, we now have access to the parks office where we can get warm, charge our phones, have some lunch. I get free parking out there, like carte blanche. Matter of fact, the police department, I even got a video of me and Sergeant, forgot his name, just that quick. But anyway, we connected with the police department who thought it was an awesome thing that we're doing. They started giving us key spots that we could navigate and provide some support. Narcan trainings, just talk to cats out there who are still using, let them know, dude, listen, man, nothing surprises me. Been there, done that. What do you want to do now? Because nobody really wants to die. Nobody really wants to OD. We got to find out what happened to you, not what's wrong with you, but what happened. Because the trauma is there is real deep, because I know it was with me. So, this is all we try to approach, and we try to provide emotional support. We try to be instrumental in their recovery process. We provide informational support, and most of all, just spiritual. Listen, man, I love you. Let me love you till you learn how to love yourself.
Wow, great stuff. Well, like they say, you only keep what you have by giving it away.
Absolutely.
And definitely, you were so freely giving what was given to you, and that just really warms my heart. And I got chills listening. Very cool. So you guys are just filling us up with such great stuff, and we're going to ask you for some contact information too, so that we can make sure to put it in the comment section, and maybe at the end we'll also announce it. But that brings us around to Jessica, who's the glue that pulls us all together, because without Jessica doing all this, none of us would be here. We've talked a lot about NYC Pop. We just did a podcast on it, and we'll mention a little bit about the prevention stuff at the end. But Jessica, what's your role in all of this?
I have the pleasure of working with you all, so it's been great. To what Dr. Slattery had said, everyone is in their own silos doing great work, and to be able to bring us all together and learn from each other and build off what each agency has done so far has been, it's been great. We meet a lot. And unfortunately, during this pandemic, obviously it's all virtual, but even with that, I feel like we've gotten so much done so far, building, referral platforms for, those in need 24/7, but, those coming out of Rikers so that they can utilize our treatment clinics from all of our network providers, just trying to fill the gaps, because there are so many services out there. And I think the biggest issue is the connection and understanding what each agency does and who does what. And so, I emphasize the meetings. We do meet very often, and it's super important, because everyone has something to give and something to learn. And we're excited to see how things progress. And continue to bring much needed change and new ideas to those living in the city. I'm trying to think. We have for those that are familiar, there are 2 now safe injection sites in New York City. And so we've been working closely with them. Anything that the city is rolling out, new initiatives and stuff, I feel like the CASN providers are right there on board. I just mentioned the release program from Rikers, a lot of inmates coming out that are in need of services. We're right there with our, providers, ready and willing to, work with all of the clients coming out. As Troy mentioned, we're working with the Manhattan Borough President at the Washington Square Park, and, really trying to be there, at off hours and being able to meet and greet and get to know our clients and build rapport, and ultimately, take them through the process along with us and with all, our teams that are involved.
If I could just add to Jessica's stuff. So we talked about the clients and everything that the clients are able to afford. the grant and the providers are also working with significant others, family members, or individuals that maybe the client doesn't want to, get the help or doesn't recognize it or doesn't think they need it, but the family member or the loved ones or significant others of that individual can get help. So, you don't have to, we're not just gearing just to the clients, it's to the families also. So a family needs help, the family wants to be educated, the family needs to talk to someone, to get the help to be able to help the client recognize also, we can help those individuals as well. So it's really for anyone who's been affected with someone who has addiction or mental health.
That's so great. And, my spouse is a licensed clinical social worker, and she always talks about, the systems approach and the families and the way it was always done in the past. And we got so far away from that, but how
Right.
wonderful that we're returning to that again. Now, I know the prevention piece, a lot of our providers are able to offer, prevention programs to parents who are in treatment or in recovery or in a shelter, because we often forget about those populations. And Jessica, would you just mention the agencies that are involved? Obviously we're Children's Aid, but who else is doing the prevention pieces, and what are the programs being emphasized?
Yeah, absolutely. So in addition to Children's Aid, it's Education Alliance, Mental Health Western Queens. Hold on one second, drawing a blank, of course.
It's okay. You have so many meetings, I can
Right? I'm like,
understand.
wait, out of the 21, hold on.
We have 5 providers, I know that.
Yes, we do.
And I'm always forgetting who they are too. But that was 3, and there's 2
We have
more.
Argus Community. Apologies for forgetting you, Argus. And there's one more.
We'll give you a minute to look it up. You're working with so many agencies.
Yeah. Can I just say something too? We're talking about the recoveries and / clients, and I just wanted to give a shout out to Jessica and her team, because they also provided a meeting for the peers to go into on Wednesday, so that we can talk about how we're feeling, because we absorb a lot out there. We see a lot. It's a lot of trauma. And we have a platform. They provided a platform for us. Like she said, we meet a lot, every week, to just the peers, to talk about our experience doing the outreach, our experience doing the harm reduction, what kind of barriers are we going up against, how can they be more supportive to us. They want to get us hoodies, and they want to make sure that we're safe, and I just wanted to mention that, that they also provide the services for the peers who are actually doing the work also.
Troy, thank you. Thank you for reminding me about that. Yeah, that's been a great platform for our peers. And, one of the biggest initiatives was, to substantially increase the number of peers that we have across the city. And so by doing so, it's important that, we created a platform for everyone to, to learn from each other and to share, what's working, what's not, resources and referrals. Because like I mentioned, everyone has a whole slew of things that they know in their back pocket, but it's ultimately being able to pass that along to each other in real time is where, the work is done. So Troy, thank you for that. And just real quick, going back, okay, our prevention providers, I got it all now, right? So we have Children's Aid, we have Argus Community, Mental Health of Western Queens, and then Education Alliance, and the Network for Human Understanding. So,
Right.
And, to Ronnie's point, with the prevention, what's been great too is bringing, the prevention programs to, youth and families, and really being able to market it, right in communities. We've heard from some of our prevention folks that literally stand near subway stations and are handing out information, and at their food pantries, and just really being in touch with the communities and being able to provide these resources, has been huge during these difficult times.
Yeah.
No, I've been
Go ahead,
quiet.
Chevar.
I've been quiet the entire time. And the reason being is because the energy that you guys all display, the passion that you guys are displaying for the work. Dr. Slattery, you opened up, sharing a wealth of information. I'm you guys probably see me looking off to the side. I'm taking notes. And I'm even taking notes on what should we call the show. And you said something, Dr. Slattery, there's no wrong door. I think that's amazing. It's amazing for anyone to hear that there's no wrong door. We focus so much on the negatives and what people can't do. Well, no, you can do. There's a door for everyone. I appreciate that. Troy, you said a lot also. I'm looking at my notes also. a couple things, you know, because we always think about what we're going to call the show. We possibly the recovery process, or rather the episode. You said something, I lost the second word you said. It was community something. If you remember it, don't worry about it. But it was community something. You said recovery walk. I thought it was amazing. I'm like, wow, this is all amazing stuff. You said something I said, I used to be a program director, and I did my best to choose a specific words working with you. And you said something similar that I used to say, and that was you said bad decisions. I usually say young people make difficult decisions. Like there's no wrong decision. It's a difficult decision. You had to make a decision based on how you felt at that moment, and you possibly thought it was right at that moment, but what was you didn't think about the consequence. So was it, you know, now there's a consequence, it becomes a difficult decision that you made. So so when you said that, I kind of like, yes, I say that too. So that helped me out. That meant a lot to me to hear someone else uses the same, may not be the same word, but the same concept, you know, in your practice. And Jessica, I want to applaud you because you're like someone probably said earlier, the glue. Like you lead every meeting. I see you every 3 weeks, you know, and you bring all this together. Like I'm sorry, I wouldn't be able to remember all 21 partners either. So don't hold that against her for having to look it up. That is human.
I am kicking myself.
That is being human, and that's something I talked to Ronni about. We always talk about you know, I think Troy said this earlier, looking at the actual person, like what caused you to get to this. There might be trauma. We're all human. There's something that pushed us in a direction that we have to look at, whether the direction was a positive direction or a difficult direction. Like looking at the whole person is so important to me, and what you guys are doing, bringing everyone together, whether it's prevention, treatment, harm reduction, bringing everyone together is a way to look at the entire human, looking at the entire person from the ground up. I just wanted to share that. I'm sorry, I went on a little rant.
Okay. Okay.
I'm taking notes over here.
That's right, man. After a while, you know, I speak about this so much, and I just always say, you know, it's not a job. You know, it's a commitment to my own recovery process, and it's just a commitment to loving life, you know, and you want to share that with people. I want you to love life, man, you know.
Yeah, that's so important. And I always say to people, if you don't love what you do, then do something else, because you spend so much of your time doing it. You know, and I've been doing this a long time. I'm not going anywhere for a while. This is part of my recovery too. And it's really important to keep doing this work. Just so much, you know, again, the prevention piece too that we want to mention is that NYC POP is also funded by this grant, you know, and we're basically have become the New York City Prevention Council. So there's so much going on all levels. And, you know, we this is great. And we're going to have to do this in at least 2 or 3 parts, because it'd be great to check in a few months and see how everybody's doing and anything new. But this is the part of the show where we ask you the fun question. We always ask every guest this question because we like to end on kind of just a fun, silly note. So I'm going to let Chevar ask that question right now.
Absolutely, but I also want to acknowledge CASN also for bringing new partners to NYC POP. Like we have education, we have a ton of you guys from Education Alliance who support POP. It's like, which we appreciate, and they take on a lot of support roles within there, as well as August and all the other partners. But the question is, take yourself back to 10 years ago when you were a child. When you were much younger, what did you want to be when you grew up? So you were this child 10 years ago, and you say, you know, when I grow up, I want to be this person or this thing. Like for me, I wanted to be a NASCAR driver. I live in Harlem, like that's that attainable. So, because I watched NASCAR on television. I like fast cars. When I was a kid, I also wanted to be a firefighter. And I realized I don't like hot things. But my job is to save lives, and that's why I'm still here. I talk fast, so I'm a NASCAR talker. and a lifesaver in the job that I do now. So who wants to go first and share and tell us why? Like, why did you want, if you want to be a sock folder, tell us. Who wants to go first?
Jessica, you on first?
I mean, I feel like I am still thinking, but it's bad. I know, I'm like 10 years old, we're going back a bit. I have to say, probably it would have been like, if this is right, to be a professional athlete. So I'm a tomboy at heart. I've played sports all my life. So, you know, although, you know, I don't anymore, you know, I think it's similar in terms of, you know, working as part of a team and, you know, kind of being close with all different walks of life and having a common goal. So I do see some, you know, overlap from what my 10-year-old self was thinking I wanted to be to what I am now.
Well, that was good. I don't know if I can beat that one, but so when I was 10, I used to line up my dolls and teach them. I wanted to be a teacher. I always wanted to be a teacher. And I went to school, became a teacher, but I think now in my adult life, I think I'm still doing that. You know, I ended up getting into the healthcare field and I ended up wanting to give back and be an advocate. And I think an advocate and a teacher go hand in hand because the teacher advocates for their students. And anyone who knows me or works with me, I have a lot to say. And I think that I'm always trying to give back and always trying to educate and advocate for individuals.
Yeah, yeah. You know, that's a loaded question, man, because I'm actually doing what I actually wanted to do as a teen. I wanted to be a performer. I wanted to be around people. I wanted to talk to people. I wanted to be an orator, a preacher. I wanted to be you know, I just wanted to be out there. I wanted everybody to see me because I had a Napoleon complex. You know what I'm saying? Like I was really short. I was always like the shortest kid in school, right? And so, and like to this day, I don't think I've ever grown much since 8th grade, right? I just grew out, but you know, I always wanted to be like seen, you know. I don't have a shy bone in my body, you know. So I mean, like, it's just weird. I went through 40 years of active addiction to come out doing exactly really what I wanted to do. You know, somehow the universe said, listen, you're going to come out of it. I'm going to get you out of this. You're going to go give this stuff back to people. And guess what? Take your bass with you too. Create a music program. And matter of fact, the Education Alliance is going to give you $5,000 to help you get it along. Oh, go figure, right? So to answer your questions, I'm actually doing what I wanted to do. I'm up in the spotlight. I'm out with the people. You know, I got like over 100 so recoveries that I work with, and from prison to ACS to the courts to the homeless. I don't, you know, well, I'm in heaven. What can I say? I don't know. It just came out like that.
Yeah, you know, that's what recovery gives us, though. It lets us get back to our dreams and become the person we were supposed to be. And I mean, I wanted to be a veterinarian. Obviously, that didn't happen, but I love animals and always have animals. But I wanted to be a rock star, and I'm not giving up that dream yet.
There you go.
You know, I play in bands still to this day. You know, I don't have one right now, but
Me neither.
a pandemic put my style, but I still play, and you know, and Chevar tells me I'm a rock star, so that's all I need to hear.
That's what's up. Yeah.
But we want to thank you so much for being our guest today. Like I said, we could have you back 2 and 3 times and more because there's so much content and so much to talk about. But you really filled us up with so much hope and just seeing everybody work together and getting this information out there is so important. We will share your contact information, and please feel free to reach out to us if you'd like to come back. We'll reach out to you again in a few months. And, you know, thank you again for coming. Chevar and I are going to stick around. We're going to close out the show, and we'll be in touch. Thank you so much.
Thank you for having me.
Great,
Thank you for having me.
Thank you, everybody. Take care.
That was powerful. So a lot of information, like I stated, like the energy that they had for the work, like the passion they had for the work was so, it spoke volumes in their words.
Mm-hmm.
You know, it spoke a lot. It spoke volumes in their words. So I appreciate that, guys. I'm taking notes. I hope they don't think I'm texting. I'm over here taking.
Yeah, I knew what you were doing. But I'm just going to share some information. The after hours number, Dr. Slattery put that up there at 718-206-1990. It's 718-206-1990. That's 24/7. You can call that number. Jessica put her email. It's this is a tough one. I think we'll put that one in the we're going to put the emails in the comments because it's hard to get those, or just reach out to us. You can get our contact information from where we host our podcasts, and we'll make sure that we get that information to you. But this was great. I can't wait to hear this show back and to spread it around.
Absolutely. This is it.
This is it for today.
Nothing changes if we change nothing.
That's right. And I feel like just today we saw a lot of change happening.
Absolutely.
We're making it happen. We're watching people make it happen, and it's all changing for the better.
Absolutely.
See you in a couple of weeks.